My name is Dr. Mathew Mabao from Zambia, and I was being followed up back home in Zambia for prostatic carcinoma. I'd been followed up for 2 years because the PSA was not dropping, so the doctor back home, Dr. Pasem, said let's do a biopsy, and when the biopsy confirmed that there was a malignancy, we did the MRI also to determine the extent of the lesion. After MRI, the advice was we didn't have equipment back home for the procedure to be done, and hence the best possible place could be India, where they had the facilities. So that's how my name was presented to the ADO committee through the Minister of Health, and the Minister of Health Zambia had to look for a place where this procedure could be done. By procedure, I mean the operation, and it was found that KIMS hospital had the capacity to do the procedure, robotic assisted radical prostatectomy. And when we arrived in India, particularly Hyderabad, we were received well by Mr. Raso, together with Mr. Nagaraju, and were admitted to KIMS hospital, where the doctors had to attend to us. In particular, the consultant, Dr. Francis Sridhar, welcomed us and kick-started the process of investigations. So for 2 days, I was admitted. They did the blood tests, and the third day we did the PET scan. And after which, then consideration for surgery was put in place. Where I was admitted, they said the equipment was not there, so they had to go to another KIMS hospital, a bigger branch, where surgery was done. I should mention that treatment was quite good, though at first it was scary, but we were able to overcome the process, and surgery was successful. And after 3 days, I was discharged from the hospital and kept at the hotel, of which now the follow-up was being done at the hospital by Dr. Francis, the urology consultant. And I should say that his services were quite good. He looked after me very well. He gave me the encouragement and possible effects that following surgery, which are now resolving. I must hasten to say that I'm very grateful to Dr. Francis for his confidence and competence in executing the surgery that has put me back on the road. And so far, I have no anxiety. The result for the histology showed localized malignancy, and he further consulted Dr. Francis further consulted the medical oncologist for their opinion, who said there was no need for any medical oncology for chemo, in other words. But if I could be doing PSA follow-up every 3 months. So far, the wounds have healed, and I'm preparing to get back home. I must say it was a successful operation. And I would like to thank KIMS Hospital for the services rendered to me and very likely to many others that have come across their services. Thank you very much.